A shot of hope tonight. The first doses of the COVID-19 vaccine have arrived in Southeast Texas. Baptist Hospital and Medical Center of Southeast Texas and Christus St. Elizabeth all receiving their first batches of the Pfizer vaccine today. Each of the hospitals will receive 975 doses. The Medical Center and Christus both sending us videos documenting the arrival. And as you saw, vaccinations for frontline workers have started. No word yet when it will become available to the general public. We have live team coverage tonight, live here at 5. 12 News crews have been at the hospitals all day as the shipments arrived. 12 News reporter Amelia White's been at Baptist and the Medical Center of Southeast Texas, and our Victoria De Leon was there for the vaccine's arrival at Christus. I want to start with Victoria. Victoria, tell us what you saw there about the process.
Well, Jordan, it was actually a rather quick process. 12 frontline workers at Christus St. Elizabeth lined up to get their first dose of the COVID-19 vaccine. And after they got their shot, they had to stay behind for 15 minutes to be observed. But the room was definitely full of a lot of excitement. Now, Christus St. Elizabeth received 975 doses of the vaccine today. And before they started administering the vaccines, the staff took a moment to pray and just acknowledge what a historic moment this is. They also prayed for the families who lost loved ones to this virus and say this is only the beginning of the end. We're all still going to have to do our part to keep cases down. And while these healthcare workers are grateful for the vaccine and for being some of the first in Southeast Texas to receive it, they know some people have mixed feelings about the vaccine.
Very grateful that I had not gotten COVID, but my message would be not to be scared of the vaccine. But we really need to fight the pandemic, and I think this is the best way to do it.
Now, that healthcare worker you just heard from is actually a pathologist who works with samples from COVID patients every single day. Doctors say this is the best tool we have right now, but again, we've still got a long way to go. And today was just such an emotional day for so many of these doctors and nurses because 9 months is a long time to just be anxious. So they know that this is really providing some hope. Again, just such an emotional day for them. Jordan and Dej.
All right, a picture-perfect day there live in Beaumont, Victoria, on this historic day in Southeast Texas. I want to share these words with you tonight from Christy Wright, who is a registered nurse. She said, quote, "I want to do all I can to help not spread this deadly virus." She was the first nurse in Southeast Texas to receive the shot. She's at the Medical Center of Southeast Texas, and she says this really was the glimmer of hope she's been looking for. 12 News reporter Amelia White live with us as well tonight. Amelia, can you tell us why this is especially personal for her?
Jordan, like you said, indeed, she was the first nurse to receive the vaccine here in Southeast Texas. And for her, it was for personal reasons. Both her mother and father tested positive for COVID-19 this past summer. Unfortunately, she lost her father to that battle. And so taking the vaccine today just wasn't something she had to think twice about. It was an emotional day as frontline workers at the medical center lined up to get that shot in their arm. Wright is a registered nurse and she works on the COVID medical floor. She was thrilled to be amongst the first to receive the Pfizer vaccine, but she's not the only one filled with joy on this eventful day. Brenda Johnson, pharmacy operations manager at Baptist Hospital, says it's amazing to not only witness history, but to be part of it.
I think we're very excited with the arrival of this vaccine. I think it embodies hope for a lot of people. So it's really exciting to be part of this time.
Now, Baptist will begin to administer the vaccine to staff members over the next 2 weeks, Monday through Wednesday. And once the workers receive their vaccine, they'll get this cute little sticker that says, "I got my COVID vaccine." Now, before they get things running on Monday, tomorrow morning, they will hold a vaccine trial run for 5 physicians who work directly with COVID-19 patients. The purpose of this is to simply make sure everything runs as smooth as possible on Monday. For now, live in Beaumont, Amelia White, 12 News.
Interesting to see each of the hospitals doing things just a bit differently. I want to update you on some breaking news tonight. A second COVID-19 vaccine has been recommended for emergency use by an FDA advisory panel. The next step for the Moderna vaccine is to get that emergency use authorization from the FDA. That could come within hours, certainly within days, according to experts who are following this. The action will provide a boost to the largest vaccination effort in U.S. history. Once it's authorized, U.S. officials say the initial shipment of nearly 6 million doses of the Moderna shot will go to healthcare workers and to nursing homes. So what happens next now that the first round of vaccines have been distributed to 110 providers across the state of Texas? Well, that's a question that Governor Greg Abbott addressed during a news conference in Austin. The governor called Operation Warp Speed a monumental medical miracle. As of today, 224,000 vaccines have arrived in Texas. With the Moderna vaccine expected by next week, he said the state should be able to have more than 1 million people vaccinated by the end of the month.
We'll be delivering to not just hospitals, but healthcare centers, clinics, pharmacies, freestanding emergency rooms, urgent care centers, long-term healthcare facilities will be receiving these vaccines later on this month, as well as local health departments, state hospitals, and state-supported living centers.
So really a diversified distribution effort. One thing the governor says that's not in Texas's future, any more shutdowns. The governor making it very clear at this news conference that he plans to put shutdowns behind us. All right, I want to update you on what's happening right now. We've certainly taken some major steps forward this week in the fight against COVID-19, vaccines reaching virtually every corner of the country, but that does not mean that we can stop taking precautions. Many of you have reached out to us with good and certainly very valid questions about the next steps in the rollout and what life will be like in the coming months. 12 News anchor Kelsey Johnson took the questions to a Beaumont doctor.
It could be April before people outside of the health industry are able to get vaccinated. I asked Dr. Ray Callis some questions regarding ways that you can start preparing now. First question, when the vaccine is available to the general public, what do people need to do?
Right now, they're only in small number of batches because you got to realize that we're trying to get to hundreds of millions of people throughout the United States. But as it rolls out, the best thing that I would recommend you do is contact your primary care physician. Also talk to your local health department. And, as things roll out, I promise you we will have a lot of information coming out via social media and radio and television as we get more and more vaccinations available.
How can people begin to prepare for the vaccine now?
I think that in order to make people's fears subside, I think that the appropriate thing is to continue to look and look for publications and actual scientific data.
Well, what are some examples of trustworthy sites for research?
I would recommend that if you look at any credible scientific journal, like if you get something from the New England Journal of Medicine, or if you get something from the American College of Surgeons or the American Medical Association, or if you look at the Centers for Disease Control, definitely look into all those different platforms. The other thing I would tell you, too, is that if you look at the state of Texas, whenever they come out with based on their health recommendations for the whole state, that will be another avenue.
Dr. Callis says do not look at random posts on social media. Make sure you're reading posts from your local health department and do not use Wikipedia. At 6, Dr. Ray Callis is answering more questions, more specifically about the second dose of the vaccine. Kelsey Johnson, 12 News.
All right, we are tracking hospitalization numbers in Jefferson County tonight. The ICU beds are still virtually full, 1 remaining, and 48% of the patients who are there in ICU are battling COVID-19. 13% of the general hospital patients in Jefferson County have the virus. Even as the vaccine arrives in Southeast Texas, we're facing a dire situation heading into the Christmas holiday. We just showed you those rising hospitalizations. On top of that, more of our neighbors are dying from the virus. As 12 News reporter James Grant explains, December has proven to be the deadliest month so far in this pandemic in Jefferson County.
Dr. Praful Yoshi with Lamar University tells me we're at the point where over 4% of the Jefferson County population has tested positive for COVID, an alarming statistic. In just the last 3 days, Dr. Yoshi says there have been 21 COVID-related deaths in Jefferson County. This is the most deaths in any week since the start of the pandemic. According to Yoshi, most of the recent cases and deaths can be attributed to people gathering over Thanksgiving. This recent uptick in cases and deaths was expected, but considering the rising positivity and death rates in Jefferson County, Dr. Yoshi fears it will get worse before it gets better. As you can see, the death rates have been higher in rural counties, with Jasper County having the largest % increase in COVID deaths from the middle of July until now.
It's been pretty rough on everybody. Just about everybody knows somebody that's
been infected or that have been hospitalized or have lost a loved one at some point or a close friend to this.
Jasper County Judge Mark Allen says it's disturbing to see the high number of cases and deaths in Jasper County, which has a much smaller population than other counties like Hardin or Jefferson. At 6, I'll take a look at what Tyler County is doing as cases continue to rise there. In Beaumont, James Grant, 12 News.
All right, James. Boy, it turned out to be a beautiful afternoon, but it was a frigid and frosty start. A live look outside from our roofing 911 Skycam network, the view from Education First here in Beaumont. Chief Neurologist Patrick Vaughn is tracking some more sun. Boy, it was nice today, and also a bit of a warm-up, right?
That's exactly right. This morning,